Hey, I'm Kiera Johnson, your ortho nurse navigator here at Southern Hills, and we're going to talk to you today about your joint class and what to look forward to and how to prepare yourself.
My name is Dave Collins. I'm one of the physical therapists here at Southern Hills Hospital. We're also going to talk about some of the exercises we want you to do before your surgery to keep your body ready for your surgery.
The purpose of this joint class is to educate you, your family, and anybody that you're going to take part of this program with you on what to look forward to, decrease your anxiety. Surgery is scary, we get it. So this is to help you prepare yourself, family, and get to know what you need to do to discharge, and to help you understand what it's going to be like here in the hospital.
So, Kiara, why would anybody want to go through a joint replacement?
Well, Dave, let me tell you, we want to go through a joint replacement when we want to improve our mobility, decrease pain that we've had for so long, enjoy a more active lifestyle, run, hike, go to vacations, things that we haven't done in a long time because our joints have hindered us. We're going to try to get that back with doing this joint replacement. So we have two different types of joint replacements. We have a total hip and a total knee. Our total hip is of a replacement of 4 components. You have your femoral stem, your cup acetabular liner, the acetabular piece,
And the femoral head.
and our femoral head, Mr. Dave. And it's made of a titanium cobalt metal, which means as much as you use it, the stronger that metal will get. So do not baby that replacement. Put as much weight on it as you can tolerate. Now, our knee replacement is also made of a couple of components. We have the cement that puts it all together, which puts the tibial and femoral piece together, and they cement it. It also has that titanium cobalt metal in it, which means don't baby that joint. As much as you use it, the stronger it will get. Put as much weight as you can tolerate on that, and it will do you just well.
Wow, Kiara, a knee or hip replacement sounds great, but are there any precautions that somebody has to do after they've had a hip replacement?
Well, yes, there's 2 different approaches. We do an anterior approach and a posterior approach. Our anterior approach goes through the front of your leg. Of course, posterior, we're going through the back. So the anterior approach, you can cross your legs. We still don't want you to do any lunges. We want you to pick up your feet and turn your body. Nose and toes go together always. With the posterior approach, we can't quite cross our legs. It's best that you keep a pillow in between your legs. Squat down, again, same thing, nose and toes go together. Practice picking up your feet and turning your whole body in that same direction that you're trying to turn to.
So basically, don't stand on your leg that's operated and pivot on it. We don't want you to pivot on the operated leg.
No, we do not want to overextend those muscles after just having surgery. That will cause you a lot of pain.
All right, so Kiara, we've talked about the precautions on the hip replacement. Are there any precautions on a knee replacement?
Yes, sir. There are some precautions on the knee. So we want you to, we're promoting extension with the leg. So we're going to bring you out of surgery in a heel prop position, meaning that you'll have a folded pillow or a rolled towel under your heel, so that way your leg can extend and you can heal with that leg being extended instead of bent. So it is uncomfortable. So remember, when you make it home, nothing under that knee. Heel prop, meaning pillow or towel under that heel to promote it to extend. Also, we don't want you to pivot on that leg either. Same thing with the hip. Nose, toes, turn together in one motion, all at the same time. Mr. Dave, with talking about all these joint replacements, I know we have to protect them some type of way. Is there a way that we can promote healing with these joints?
Well, sure, Kiara. We got exercises that we are going to do before your surgery and exercises you will do after your surgery. Now, I know you think you can't do exercises because you have bone-on-bone pain, but these exercises are all designed for people with bone-on-bone pain. They're going to be with you lying down without having to put any pressure through your knee or hip joint. So this is the way you will prepare your body for your surgery and prepare yourself for after your surgery, when you're going to have to do even more exercises to get back to where you want to be. All right, so now we're going to work on doing some physical therapy exercises that you're going to do before your surgery and after your surgery. And Kiara is going to be our patient and I'm going to be the therapist. Let you get up there, Kiara. Good. All right. So now the first thing we're going to show you is position of a knee after a knee replacement, you will have either a towel roll or a blanket that will be underneath your ankle that will keep your leg straighter. This will be the position that you'll be in after you come out of surgery. That afternoon, a physical therapist is going to come in and you're going to go over some of your leg exercises. First one is called a quad set. You're going to just push your knee down into the bed, hold it 3 seconds, and relax. Again, 3 seconds and relax. You'll do 15 of these. The second exercise is called a heel slide. What you'll do is just slide your knee up and down the bed and back and down. Good. And up and down. Good. The third exercise is called a glute set. And this is the exercise where my coworker Kelly says, pretend like you've got a $100 bill underneath your bottom and you're picking it up with your bottom cheek. So you're just gonna squeeze the cheeks, good, and relax 15 times, all right? So those are your main 3 exercises we want you to be doing at home before the surgery so that you will know how to do after the surgery. It's easy enough. The quad set, the heel slide, and the glute sets. Also, there's one more exercise that we would like for you to do if you are having a hip replacement. And that would mean for your operated hip to kick out to the side, which is called hip abduction. And this works the muscles that are outside of where you're going to have the surgery, your hip abductors. So if you can do this before the surgery, it'll get you ready and get your muscles going before and then get them ready for the exercises afterwards.
Anytime you have surgery, you're at risk for different things happening. We have risk for blood loss, which we give medicine during the surgery procedure to counteract that. We also worry about blood clots. Blood clots tend to hang out in the calf area when you have surgery, but we also give medicines to prevent that from happening. We also worry about clots traveling to our lungs where we would get pulmonary embolisms or to our brain when they become a stroke. Again, we do things proactively so those things doesn't happen, but again, they are a risk. We are at risk for anesthesia problems. Some people have nausea, vomiting, just feeling yucky and groggy after surgery. We have medicines that we can give beforehand when you make it to our floor and all of the things to counteract those as well. We also have worries about scar tissue. Anytime you cut through skin, muscle, you can develop scar tissue. Then our last thing that we worry about are neurovascular changes, numbness, tingling. I know with our knees, we use nerve blocks. So things like that, if it becomes too much or feels too weird, please let your nurse know.
Okay, listen, Kiara, what should somebody do at their house to prepare for having surgery?
I'm glad you asked. Be prepared. We love proactiveness. So get that room together that you're going to hang out in. Get that recliner set. Get that area where you want your snacks, your toiletries, anything that you might need that's close to you, your meds. Get you a little section together in your home. That'll be your little hangout area for a little bit. Cluster your care. Make sure we get rid of cords, rugs, anything that can trip us up, because we do not want to cause trauma to this new joint. We need to protect it by any cost. So prepare your home beforehand so that way when you come home, you can relax and heal.
I always tell people, pull up your throw rugs, get the rugs out of the way, make a path for you that you and your walker can get through your house. You know?
Yes, safety, safety, safety. It's so important. Also before surgery, you have to come in what we call a pre-admit testing procedure. So this is when we get your medical history, we get lab work done, we get all the things to prepare you for surgery. We also go over medication history, what meds we want you to take before surgery and what meds we don't want you to take before surgery. A lot of those include like your GLP-1 drugs, your Wegovy, Ozempic, things like that. We don't want you to take those at least 7 days prior to your surgery. Those kind of help mess up your stomach, bring nausea, just does not end well with the anesthesia and all the meds that we give you. So to counteract all of that, we just recommend that you do not take those 7 days prior to surgery.
They are ready to come in for surgery. What should they do the night before or the morning of their surgery?
Well, I'm glad you asked. We do swab you at your pre-admit testing for MRSA, which is a lightly swabbing your nose that we detect if you have any bacteria growing in there. If you are positive, we give you an antibiotic ointment that you rub in your nose and also give you a 5-day cleansing soap that you have to use for 5 days. That 5th night, you will be the last night for that antibiotic ointment and the shower. You will take a nice clean shower before coming with the surgical soap that the pre-admit testing nurse will give you. You'll clean, make sure you have clean sheets, clean pajamas, and all of the things. We do not want to reintroduce those germs that we just washed off with that special surgical soap. Also, if we like to shave, we recommend that you do not shave 2 days prior to using that soap if you are MRSA negative, because that can kind of burn and you don't want that, girlfriend. This is our surgical scrub that you will get. Like I said, if you're MRSA positive, you will use this scrub for 5 days. That is the 5th day will be the night before surgery. Make sure you have clean towels, clean sheets, and clean pajamas. We do not want to reintroduce the bacteria we just washed off and reintroduce before we go to surgery. If you are not MRSA positive, you can just use this the night before surgery and the morning of surgery. Again, make sure you have clean sheets, clean towels, and clean pajamas or clothes before you come into the hospital.
So we've talked about getting yourself ready the week before the surgery, your medicines before the surgery. Is there something you should do the night before the surgery?
Yes. Feed yourself. Treat yourself to a 5-star course meal, darling. Get that steak, that lobster. Treat yourself because of what you're about to go through. It is going to be a life-changing. So do that for yourself. Pack you a nice bag, good comfy clothes so you can work with therapy, any toiletries that you need to make you feel good, smell good. All of that is a part of your care as well. We also do an enhanced surgical recovery program, which is a research-based program that allows you to drink up to 4 hours before your surgery as well to help counteract nausea. So do that for yourself as well. And this is your enhanced surgical recovery drink. This is a drink that you can drink up to 4 hours before surgery. It helps with nausea and gives you those extra carbs that we have to cut off after midnight. So this kind of helps counteract any nausea that you have. If you are diabetic, we prefer you use Gatorade Zero or Powerade Zero.
So Kiara, we've talked about what to do before the surgery. What are we going to do on the day of the surgery?
Well, day of surgery, you're going to arrive to our hospital 2 hours before surgery. You can bring up to 2 family members over the age of 18, of course, to come back to the pre-op area, meet the surgeon, meet the anesthesiologist, and get any questions out that they might need.
Great. Now, how about in the hospital room? How many guests can you have there?
You can have one person stay overnight with you to help you with therapy, keep you company, all the great things. Only one over the age of 18. You'll then get rolled down to the OR room, of course, do your procedure. You'll hang out in PACU, which is our recovery area, for at least an hour. They can medicate, give nausea medicines, all the things you need down there as well. You'll hang out with them, make sure vital signs are good, make sure you're not having any post-surgery complications, and then that begins your journey coming up to the 5th floor. I like to call it the penthouse suite. That's where you'll meet your physical therapy team, your occupational therapy, and your nursing staff. Another important piece in your room is your call light. That is how you'll get in touch with your nurse or your tech. That big red button, you push that, you'll get whatever you need, darling. It also controls your TV and it controls the lights above your bed. Now let's talk about how we prevent infections, starting here at the hospital and once you go home. Your surgeon is going to place a silver Mepilex dressing on you. It has an antimicrobial pad in it to help fight infections. That is good for 5 to 7 days. You can shower with it. Just do not submerge that incision in any water. Hot tub, pools, bathtubs. You just want the water to run over. Pat completely dry. Make sure there is no moisture because bacteria loves moisture. Also, coming out of surgery, you'll have TED hose on your leg that is going to help promote circulation about those blood clots that we mentioned earlier. You're going to wear those and you can take them off once you get home and all the things, but while you're here in the hospital, we promote that you wear them just to help with that extra circulation.
Basically, during the day, you're going to wear these. At night, you take them off, all right? So every day, all day long, you wear your TED hose. And at night, you don't wear them, right?
Right. Also, with our knee surgeries, you'll come out wearing an ACE wrap. While you wear that compression with the tight wrap, it is going to help with that swelling. You want that to help be able to move with therapy and all the things as well. We also promote using ice. Ice will help that inflammation and swelling within that joint as well. We recommend an hour or two on and an hour or two off, and just alternating throughout the day as you feel. Another number one way to fight infection is hand washing. Make sure whoever is touching or helping you with that operative leg are very clean, have very clean hands. Your hands are clean as well. We don't want to introduce any bacteria to that area, because the last thing you want to do is have an infection with a new joint.
So Kiara, the surgery's been done and they've been taken to the 5th floor. What happens now?
Now we put that joint to work. Now you'll get acquainted with your nursing staff, your tech. You'll also be able to meet your physical therapy and your occupational therapy. Normally day one, physical therapy is coming to see you within the first couple of hours of you being on the floor. The earlier you get up, the better you feel and the better you heal. So that is to look forward to. Occupational therapy, sometimes if you're thinking about going home the same day, we'll see you the same day, but normally they will see you day 2 of surgery. That is how you put on your clothes, ADLs, putting on socks, bathing, those kind of things that you have to kind of relearn after you get these new hips and joints. Going back to your in-room supplies with your ice pack and your TED hose and all of these things, this is another important tidbit. This is your incentive spirometer. This is the device that you will suck in like you're sucking on your favorite milkshake, and you're gonna open those lungs and release that gas, that anesthesia, so that way we don't get pneumonia, atelectasis, or that groggy feeling. This helps release that gas from our lungs. You'll also meet case management. Case management will give you the things that you need to go home. Your durable medical equipment, like your walker, your bedside commode, things like that that you need to help heal at home, that we have here at the hospital as well.
Your case manager is going to provide you with a walker if you need one. But if you have your own walker, we want you to bring that with you on the day of surgery. And your physical therapist will make sure that that walker fits you as a patient. So if this was your grandfather's walker and he was 6'2", and the patient is Kiara's size, we are going to make sure that that walker fits you. And I'm going to show you how to do that right now. A walker should always be at a patient's wrist level. So these walkers adjust. We will see if this is Kiara's wrist. And guess what it is? All right. So that is the proper level for how a person would walk with a walker, all right? And when you walk with the walker, you're going to take a step forward to your operator leg first. So here, the right leg, left, and the right, and the left. And the physical therapist will show you how to walk with your walker after the surgery. So this is called a gait belt, and a gait belt is a tool that physical therapists use in the hospital to help guide a patient in case the patient is woozy, might lose their balance, and the physical therapist will put this around you before he or she walks you for the first time. So the gait belt works like this, and you will be going home with a gait belt in case you and your family members need to use it on you, all right? So a gait belt goes on a patient with the tag out, all right, and the teeth out. So just remember, you put it around the patient, you put it around her waist, the teeth are out, and then you loop it in, and then you would grab the patient from behind and walk with her in the hallway or up your stairs or anything that you might be worried about the patient moving, okay? All right, so everybody's seen the patient. They've all signed off on the patient. They're getting ready to go home. What happens then, Kiara?
I'm glad you asked. It's time to go home. You've kicked therapy's butt. Therapy has signed off. Your doctor said you're doing great. Nurses have controlled your pain marvelously. Now it's time to discharge. We'll make sure you have all your equipment, like you said. We'd like you to go home. Home, you heal better, you have less chances of getting infections. But if you and your surgeon have talked about other realms of healing as far as in rehab or skilled nursing facilities, your case management will help set that up too with transportation, getting you a bed, all the things will be set up from here to transportation to your rehab. But of course, we prefer you to go home. You do well at home, your body feels good at home, and you just overall have a better experience in your own environment. Once you're home, take it easy. Find that happy median. Don't do too much to where you cause pain. Don't do too little or you become stiff. We want you to stay loose and limber so those joints have time to find their way again and heal properly. Signs and symptoms to look out for infection. If you notice any swelling, red streaks, a smell coming from it, discharge, just looks angry, like something is not right, please call your surgeon and let him know what's going on. If you have a temperature of 101.5 or greater and does not go away with Tylenol, please let your doctor know so that way we can get you in and make sure we're not fighting any infection. Signs to skip doctor and come on straight to the ER. If you're having problems breathing, coughing up blood, just feeling like something is not right and apprehensive, just come on to the ER and let us check you out. I'd rather you be safe than not. Now, you have this joint, right? We want you to have this joint forever, for the rest of your life. But we also know coming foreign objects in our body, bacteria loves foreign things. So anytime we have dental work, now that we have this new joint in our body, we want you to get on an antibiotic regimen 1 hour before any type of dental procedure. This is just to make sure that no bacteria that hangs out in our mouth will travel to that said joint. So you can ask your surgeon or your dentist, just let them know, hey, I have a joint replacement and I need an antibiotic an hour before I come do my procedure. They are more than happy to send you that prescription.
So Kiara, we've learned everything we need to know about our procedure here. So is there anything else that you want to say in closing?
I want you guys to remember, you only get what you put out of it. You want the best joint possible, so you put the best effort possible. Remember why you're doing it. Remember your why. Remember those grandchildren. Remember those vacations. Remember why you're doing this, to get the better quality of life that you deserve.
And one thing, like I always want to tell people, that people have told me, before they were in constant pain, and after the surgery, they were in healing pain. So after the surgery, you are in healing pain. You're going to heal and you're going to get your life back together after the surgery.
Yes. Thank you for listening. Bye.